Hello everyone, welcome to Physiolite. Today I am going to explain hydrocephalus causes. This video is a continuation of my previous video. In the previous video I have explained about the definition, types and also the production, circulation and the drainage. So if there is an imbalance between the production, circulation and drainage, the hydrocephalus is caused. So what is the causes that result in the hydrocephalus is, first one is production. In the production we have tumor of the choroid plexus. As in the previous video only I have said that the CSF is produced in the choroid plexus of the lateral ventricles and third and fourth ventricles, mainly the lateral ventricle. So if there is a tumor in the lateral ventricle, if there is a tumor in the choroid plexus, the production of the CSF is increased. The tumor in the choroid plexus is very rare and it is a hyper functioning tumor. So the tumor is hyper functioning. That means wherever the tumor is situated, it makes the organ to function more. So hence the choroid plexus function is to produce CSF. So as it is a hyper functioning tumor, it produces more and more CSF, thus causes an imbalance between the production and drainage, thus results in the hydrocephalus. Second cause is circulation. In the circulation also we are having block of the foramen Monro. So in the previous video we have learnt that what is the function of foramen Monro. Foramen Monro helps the CSF that is produced in the lateral ventricles to flow into the third ventricle. So the block of foramen Monro also causes hydrocephalus. What is the cause for blocking of the foramen Monro is cyst in the third ventricles. There is a presence of a choroid cyst in the third ventricles. So this is the lateral ventricles, this is the third ventricle and this is the fourth ventricle. So if there is a cyst in the lateral ventricles, this causes the blockage of the foramen Monro. So here is the foramen Monro. This cyst causes the blockage of the foramen Monro. So the cyst that is present in the third ventricle, it is tumor like ball. So in the third ventricular appendema. So this causes the foramen Monro to block, thus enlargement of the lateral ventricles of the one side. So here in case if it is to the right side, only right side ventricle will be enlarged. And if we see the MRI or CT scan, only one lateral ventricle is enlarged. Then the foramen Monro. Then in the foramen Monro, and thus this kind of blockages are called asymmetrical enlargement of the foramen Monro. So asymmetrical enlargements of the lateral ventricle. So only here we are having cyst. So only this side will be enlarged. And next one is blockage of this cerebral aqueduct. Here we will be having aqueduct. Aqueduct where it is present between the third and fourth ventricle. So here there will be a aqueductal stenosis. So the blockage of the cerebral aqueduct, it is a congenital. Some babies born with the aqueductal stenosis. In this case, lateral ventricles and third ventricle are enlarged because the aqueduct is present between third and fourth ventricle. If there is a blockage in between the third and fourth ventricle, the third ventricle as well as the lateral ventricle are also enlarged. So here we will be seeing the symmetrical enlargement of the lateral ventricles. And also the one more cause may be the compression by the tumor. So after infancy there is a tumor. So this tumor also can block the aqueduct. So in case if we are having any tumor outside here, in case if we are having any tumor here, it also causes the blockage. So tumor, it also causes the blockage of the cerebral aqueduct. So third cause for the circulation is blockage of the foramen magendi or foramen luschka. So in case there are tumors which are present in the cerebellum, if the tumors are expanded medially, it blocks the foramen magendi. If they are expanded laterally, they block the foramen luschka. If they are both extended medially and laterally, they block complete the foramen magendi and foramen luschka. And here we see the symmetrical enlargement of the lateral ventricles, third ventricle and as well as the fourth ventricle in the MRI or CT scan. And another cause for circulation problem is tuberculous meningitis. So if there is a severe meningeal infection of the meninges, that is nothing but tuberculous meningitis. So here in this case, if the patient survives also, at the base of the brain there will be a lot of scar formation. This scar formation is mainly we see caseous material in the base of the brain, at the base of the brain. So it is again headed by the fibrous tissue. The caseous material is headed by the fibrous tissue, and it causes a lot of scars at the base. Thus CSF can't circulate well. So these are the causes for the circulation. And next we see the drainage. In the drainage issues, we are having issues at the arachnoid villi and granulations. So here at superior sagittal sinus, we see this problem. So what happens here is there will be subarachnoid hemorrhage. So because of the subarachnoid hemorrhage, a lot of RBCs coagulate at the villi. So here a lot of RBCs come and set at the villi. So CSF cannot enter into the villi. So drainage problem is occurring. And also, if there is an infection to the brain and meninges, more and more WBCs come and bacteria and other debris at the site. So here also we will be having some problem. In case if it is a hemorrhage, the RBCs will be settled. In case if it is an infection, there are a lot of WBCs, that is white blood cells, that is lymphocytes mainly, bacteria and other debris also come and settle. Rarely some people have problem of impaired function of arachnoid granulations and villi. So villi are either too less or normal number but not functioning well. So villi may be too less or it may be normal. If they are normal in number also, but they can't function well, so it may be congenital defect or it may be acquired later because of any infection or tumorous cells block. So also tumorous cells also can cause the blockage in the arachnoid villi. So hence drainage also may be problem. And next one is superior sagittal sinus thrombosis. As I said you before only, blood clot is formed in the blood. If the blood clot is formed, the superior sagittal sinus is blocked. And last one is a very rare cause, which is the internal jugular vein blockage. Internal jugular vein blockage is mainly because of the tumors at the base of the cranial cavity, which causes hydrocephalus. So these are all the causes of the hydrocephalus. Along with that, yesterday we in the previous video we have learnt about the types. In the types also we are having causes. In the next video I am going to tell about those causes and also the pathophysiology. Please watch my other videos too. Like, share and subscribe to my channel. If you want any video explanation, please comment down. Thank you.